Hey, this is Dr. Darren Schmidt at the Nutritional Healing Center of Ann Arbor, and this video is about 6 good success stories I've had in this past week and then 2 bad ones. So I've never done this kind of video before, but I hope this information is helpful, and if you like it, please comment or give me a thumbs up. So here we go. So the first person is a long distance patient. He's in California, and 6 weeks ago his blood sugar was in the 130s, and then when I just talked to him very recently, it was in the 70s. And he just changed his diet, and one trick that he did was 2 teaspoons or tablespoons of apple cider vinegar, and then 2 tablespoons also of real lemon juice. And once he did that, the blood sugar went from triple digits to double digits. So that's a great success story. And now all diabetes medical doctors are taught that diabetes always gets worse, and then you get heart disease, and then they die of heart attacks. So here we just reversed diabetes in 6 weeks. Okay, the next one is a guy in London. When he was 34, he had a heart attack. He had bypass surgery, and now he's 38. And he's had tightness and shortness of breath and angina, which is the pain on the heart, and trouble walking a far distance and walking up steps. So it's been 4 or 5 weeks, and he's 20% better. And that's what I expect, and I've seen this many times before. So that's not a new surprising percent better number. And so he has plans on traveling in the summertime because his confidence is up, because he knows he can make it through these travels. Okay, the next person is a guy in Serbia, and he had a medical condition that was quite sudden a while ago. He went to the hospital, he was put on a bunch of medications, and the bottom line is that something messed up his kidneys, so he had trouble urinating and his legs were swelling up. So I sent him a bunch of kidney detox and cleaning type supplements and kidney repair supplements. And while he was on them, the swelling dropped 20 to 30%, and his urination got back to normal. So I think he'll need to do this for at least a year, probably longer. But we're on the right track. That's the cool thing. The next person is local, and she's had chronic blocked arteries and heart attacks and stents put in, and she's had 8 catheterizations, meaning they snake a scope up your leg to your heart, and they look for blocked arteries. So she had an incident very recently where they did another catheterization, this time through her wrist to her heart. I guess because they've done it 8 times to her legs, might as well switch it up a little bit. And they found no blocked arteries, and it's been a year that she's been seeing me. So that's a fantastic success there. Very happy about that. And then another guy in Texas, he's had congestive heart failure diagnosis. His ejection fraction was less than 30%, which is how well the heart is functioning. And now he's over 60%, and his congestive heart failure diagnosis is no longer. And his cardiologist asked him, well, what are you doing? And he said, well, I'm on this supplement called Saruda. And his cardiologist said, no, that doesn't work. Supplements don't work. Diet doesn't work. It's got to be something else. And he's saying, no, it's nutritional, it's supplements, it's diet. That's what's helping him. So another good success story. And then the last one is a guy who lives on the beach, and he and his wife go down walking on the beach back and forth and come back up to their house. And when I talked to him I think it was in January for the first time, he had to take breaks while walking back to the house. Well, now he can walk all the way up without stopping. And walking up to the house, he's a little bit tired, but once the land is flat again, he's okay, and his energy comes back. That's what his wife said. So she said that this past week. So those are my good successes. I'm going to share with you 2 losses, if you will. The first one is a woman with ALS, also known as Lou Gehrig's disease. It's a neurological wasting disease. Her muscles are getting weaker and weaker. When I first saw her over a year ago, she had a coating on her tongue. It was very thick. It was fungus all over her tongue. And I said to her, there's got to be a correlation between the fungus and your nervous system. And recently, like in the last 4 months, her tongue is clear, but she continued to decline and lose muscular strength. And there was even a moment in the fall in late summer last year when she got some weight back. She gained like 4 or 5 pounds. So I thought we were on the right track, but it hasn't worked out. And her last visit, she couldn't make it because she couldn't get out of bed. She just was physically weak. So I don't have an answer for ALS, although I did meet a guy once. He was diagnosed with ALS, and the doctors, he quote, they made sure I had no hope, unquote. That's what he told me. So he went home, and him and his daughter just cried for a month. And then after a month, they decided to do something about it. And he had a $30,000 electric wheelchair. And they started eating organic food, healthy food. And then within a year, the electric chair had run out of battery charge, and he never charged it up because his grandkids were playing on the chair, and he didn't need it anymore because he was walking just fine. So maybe his diagnosis was incorrect at the time, but the point is, I can't say that I have a good solution for ALS. The last one is a local guy that he came to me 10 months ago. He had pain on one of his ribs, like right here. And my first thought was cancer. And I'd seen him earlier over the years for chiropractic care. And I didn't tell him, I didn't say that I think it's cancer. But I sent him to get an x-ray. And he never came back into my office, although we have friends and associates, and I know his wife. And during the last 10 months, I was emailing him and communicating and saying, look, you need to get off sugar, because I saw that on Facebook he was eating bagels. And he told me, no, sugar's fine. My oncologist said that the research says a no-sugar diet does not help cancer. And when I talked to him 2 weeks ago, face-to-face, I said, look, it's no sugar, it's low carb, it's moderate protein, high fat, ketosis. Your oncologist is missing 4 out of 5 factors for your diet. And, well, I guess his oncologist was a childhood friend and also the former head of oncology at U of M, University of Michigan Medicine. Well, I mean, expertise and credentials mean nothing if you don't get results. And so I told him twice to get off sugar, and both times he said, nope, sugar doesn't matter. And he died a week and a half ago. And so that's a loss. And it's hard when people don't want your help. I'm sure maybe you know somebody, a close friend or family member, who's not receiving your help. And you're telling them that sugar is bad and they're ignoring you. Well, I mean, there's nothing else you can do. You don't want to pester them until they hate you, but at some point you have to draw the line and move on to the next person who will take your information. So I just want to share these stories with you. This is a week in my clinical life, and if you like this, please give me a thumbs up. Thank you.